Hello everyone, I am continuing the topic skeletal muscle relaxant. Today it is the third lecture on the peripheral acting neuromuscular blocking agent. So in the previous two lecture, I have covered classification of the skeletal muscle relaxant, then mechanism of action of peripheral acting neuromuscular blocking agent, that is both non-depolarizing and depolarizing. Then important difference between the non-depolarizing and depolarizing, pharmacological action, then important differences among these non-depolarizing or competitive neuromuscular blocking agent like long acting, intermediate acting and a short acting. So today's lecture will be on therapeutic uses and adverse effect. Therapeutic uses and adverse effect. So where we are going to use this peripheral acting. I am taking peripheral acting, this one, peripheral acting neuromuscular blocking agent, that is succinylcholine and all these non-depolarizing, which include long acting, intermediate acting and a short acting. इसके therapeutic uses और adverse effect आज के lecture में है. So what are the therapeutic uses of this neuromuscular blocking agent? So the most important therapeutic use is it is used as an adjuvant to general anesthesia. So surgery can be performed or surgical procedure can be performed easily and rapidly once we are using this peripheral acting neuromuscular blocking agent. How they are going to help? So they are going to provide, number one, the skeletal muscle relaxation during the abdominal and thoracic surgery, prevent the reflex muscle contraction during the surgery. Also, they counteract the laryngospasm which may happen if we are using barbiturate as a general anesthetic agent. Then it also assists maintenance of controlled ventilation during the anesthesia. Now, which one is to be chosen? It depends upon many things. In the previous lecture also I told you like what kind of procedure you are going to do, nature of the procedure. Number two is the duration of procedure. You can see again the same slide. So the choice of neuromuscular blocking agent, it mainly depends upon duration of procedure, number one, nature of procedure, and under the duration of procedure, if it is a short duration procedure or brief procedure like diagnostic endoscopy आपने करनी है, उसमें laryngoscopy आ सकती है, bronchoscopy, esophagoscopy, then which one we are going to prefer? We will prefer succinylcholine. But if the person is born with an atypical pseudocholinesterase, then we go for nevacurine. And same way, if it is a longest duration, doxacurine. If it is a longer, pancuronium. So depending on the duration of the surgery, we choose neuromuscular blocking agent. Then nature of the procedure. If it is a ocular surgery, then definitely competitive neuromuscular blocking agent they are preferred because they are going to paralyze the extraocular muscles at the doses which doesn't have any effect on the larger muscle. हमें चाहिए नहीं. We want only this portion, extraocular muscle, to be paralyzed. For the neurosurgery, we are going to prefer the longer duration. So pancuronium दे देंगे. Then of course definitely the patient's hepatic condition, renal and cardiac, वो सारा भी हमें देखना पड़ता है. Like cis atracurium, we prefer if the patient is having any hepatic or renal insufficiency because this is the one which is degraded enzymatically. Hoffman elimination होती है. इसी तरह cardiac patient है vicuronium, renally compromised patient है rocuronium because it is metabolized by liver. And the most important thing, even the cost. ठीक है, एक हम cost भी देखते हैं पेशेंट्स को देख के कि कॉस्ट कितनी वो अफोर्ड कर सकता है. सो इन डेवलपिंग कंट्री this pancuronium that is routinely employed. Routinely it is used because of this factor, cost factor की वजह से. Otherwise, the most frequently selected non-depolarizing agent, it is, remember this mnemonic, VCR, vicuronium, cis-atracurium and rocurium. So the choice of neuromuscular blocking agent, it depends upon many factors. So the most important use of neuromuscular blocking agent, it is used as an adjunct to general anesthesia. Number 2, endotracheal intubation. So endotracheal intubation, here the most important neuromuscular blocking agent which we use, that is succinylcholine. This is the most frequently used whenever you have to pass the tracheal tube, because it is going to induce the onset of action is very fast and recovery is also very fast. Onset of action, like within 1 to 1.5 minute you are going to achieve the excellent condition. What will happen? So jaw will be totally relaxed, which you want. Then vocal cords, they are apart with they are totally immobile and no diaphragmatic movement. This all you are going to achieve within 1 to 1.5. So succinylcholine, that is mainly employed for the endotracheal intubation. So what are the, where you are not going to use this succinylcholine? बच्चों में नहीं करना, in children. एक तो ये है इसकी contraindicate, because this important side effect, अभी आएगा वो भी, important side effect with this succinylcholine is hyperkalemia. और बच्चों में ज़्यादा हो जाता है and this leads to cardiac arrhythmia. Then second one is in elderly patient and in patient with a GERD, it causes the regurgitation. Obese patient हो गया और GERD वाला patient हो गया, उसमें regurgitation हो जाए. So these are the two conditions where succinylcholine, it is not used for the endotracheal intubation. And of course, one more important thing, if the person is having a deficiency of the pseudocholinesterase enzyme, in that case also we are not going to use the succinylcholine. Then what is the drug of choice? और फिर उसकी जगह हम क्या use कर सकते हैं? We can use another short acting neuromuscular blocking agent. So this one is succinylcholine, it is a depolarizing. Now another one is mivacurium. Mivacurium, it is a non-depolarizing neuromuscular blocking agent. So we can use this. Now the third therapeutic use is diagnostic endoscopy. इसमें भी आपने क्या use करना? We are going to use succinylcholine. जब भी आपको कोई एंडोस्कोपी करनी है, लाइक लैरिंगोस्कोपी होगी, ईसोफेगोस्कोपी होगी, ब्रोंकोस्कोपी होगी, वी कैन यूज द succinylcholine. So again the same reason, it is a short acting. So onset of action is immediate and recovery also happens very fast. So short acting, duration of action, it is the fastest acting. ठीक है, the succinylcholine, shortest and the fastest acting. ये क्या है हमारा? Shortest and fastest acting neuromuscular blocking agent. Shortest कितना? 5 to 8 minutes and the fastest within 1 minute. It is going to, यहाँ पे भी minute. सिर्फ ये है कि if the person is born with the atypical pseudocholinesterase, then only we are going to, in this case also we are going to use what? Mivacurium. ये वाला आप use करोगे. Then the third, another use is assisted ventilation. So mostly what happens, the patient who are admitted in the ICU, they need a ventilatory support. So how we can achieve that condition? By giving a continuous sub-anesthetic dose of neuromuscular blocking agent. Like very commonly we use vicuronium. Vicuronium use करते हैं, तो उसमें क्या होता है? It is going to reduce the chest wall resistance to inflation. What we are going to use here? Vicuronium. Now another therapeutic use is during the electroconvulsive therapy, this ECT. It is going to prevent the trauma and conversion. So कोई भी injury, it is not going to prevent the seizure होंगे वहाँ पे, but it is going to prevent the injuries and trauma during that procedure, because heavy convulsions that happens during the electroconvulsive therapy. So what we use here? Succinylcholine with the diazepam. And same combination here also we use in orthopedic manipulation, like if you want to reduce the fracture and any other orthopedic manipulation. So in any painful condition, यहाँ पे भी you are going to use the same combination, the succinylcholine and diazepam. Then in various different spastic condition like tetanus हो गया, status epilepticus हो गया, usually we use a centrally acting skeletal muscle relaxant, but we can use this also if it is not controlled by this. So this is about the therapeutic uses. This is in combined. I have told you the therapeutic uses of neuromuscular blocking agent. But if per chance if you get the succinylcholine, then what you are supposed to choose out of all these? One is endotracheal intubation. Okay. Second, even you can write here also as an adjunct to the general anesthesia. क्योंकि general anesthesia में जब भी है endotracheal intubation के लिए we have to use the succinylcholine. Diagnostic endoscopy. To prevent trauma and convulsions during ECT and orthopedic manipulation, इसमें भी हमने succinylcholine along with that diazepam we have used. ठीक है. So these are therapeutic uses of peripheral acting neuromuscular blocking agent. Now coming to the adverse effect. Now adverse effect, especially the peripheral acting non-depolarizing, or that happens due to what? Adverse effect. Adverse effect, they are related with the, okay. So ADR mainly it is related with the number one skeletal muscle paralysis, histamine release, ganglionic blockage and vagolytic action. Now skeletal muscle paralysis इससे related क्या adverse effect patient को हो सकता है? There is hypoxia and respiratory paralysis. This can happen. Skeletal muscle paralysis होनी हमने दे medicine ही उसलिए दे रहे. So what will happen? Hypoxia and respiratory paralysis. So usually to reverse this, we can give a ventilatory support, or we can use neostigmine and pyridostigmine. Now, what are this neostigmine and pyridostigmine? They are anticholinesterase. Now, how they are going to act? They are going to inhibit this enzyme acetylcholinesterase. They are anti-cholinesterases. They are going to inhibit the enzyme acetylcholinesterases. Now, what is the action of this acetylcholinesterase? It is going to cause the hydrolysis of this acetylcholine into choline and acetate. So, when we are giving this neostigmine and pyridostigmine, they are going to inhibit this enzyme. If ये inhibit हो गया, तो choline और acetate नहीं बनेगा. क्या हो जाएगा? Acetylcholine will remain in the synaptic cleft. It is going to cause the increase in the concentration of acetylcholine in the synaptic cleft. So if this is increased, then what will happen? अगर आपका acetylcholine बढ़ गया, so this is definitely going to reverse the skeletal muscle paralysis. This is number one. By this way, second thing is this neostigmine, it has got the direct action on the motor end plate. So these are two effects. So it is going to reverse the skeletal muscle paralysis. Second one is because of the direct action on the motor end plate. So these are the effects. But definitely this acetylcholine, it also acts through muscarinic receptor. So side effect will also be seen. कौन से side effect आएंगे? Muscarinic side effect. कौन से muscarinic side effect? Increased secretion, bronchospasm, hypotension, bradycardia. And then what we have to do? We have to do the treatment of this. We have to give the drug for this. To decrease the secretion, you have to give the atropine like drug. You can give atropine, or nowadays we use glycopyrrolate. It is an atropine analog. For the bronchospasm and hypotension, we give the adrenaline symptomatic treatment. So atropine, it is going to reverse all the muscarinic side effect which is happening, but symptomatic or supportive treatment for the bronchospasm, hypotension, we have to give the adrenaline. So another thing is, so this is muscarine, this neostigmine, that means it has got cardiovascular instability. Patient go for because of the muscarinic side effect. Then is there any alternative? Yes, we have another drug, that is Sugamdex. This is the newer one. This is a novel drug. How does this act? This is a novel drug. It is a cyclodextrin. You can say gamma. This is its structure, cyclodextrin. So it is going to encapsulate जो भी आपका न्यूरोमस्कुलर ब्लॉकिंग एजेंट है ना, depolarizing one. Now depolarizing it is going to reverse all the depolarizing. There are few like rocuronium, vicuronium. These are the two main, plus pancuronium also, right? So it is going to cause the reversal of these three drugs. So what it does, its structure is like that. It is going to encapsulate all the three. इनके आसपास encapsulation कर लेगा, then what will happen, it is going to sort of chelate all these, then it get excreted. ये cyclodextrin के साथ क्या होगा, it is going to combine with rocuronium, encapsulation होगी इसकी, encapsulation होगी, या आप कह लो ये chelation हो गया, then it get excreted in the urine. एक बार इसकी एक्सक्रीशन होगी, देन व्हाट विल हैपन, द फ्री लेवल, इसका रॉक्यूरोनम का फ्री लेवल इट इज गोइंग टू फॉल, देन व्हाटएवर इज बाउंड टू द न्यूरोमस्कुलर जंक्शन दैट गेट डिसोशिएटेड. सो न्यूरोमस्कुलर ट्रांसमिशन आपकी होगी. सो दिस इज द वन विच डज नॉट हैव, इसका क्या एडवांटेज है, एडवांटेज ऑफ दिस वन इज नो कार्डियोवैस्कुलर साइड इफेक्ट. कार्डियोवैस्कुलरली ये स्टेबल है, ठीक है. नो, another side effect of this adverse effect is second one, number 2, prolonged apnea. कौन सा इसका side effect, prolonged apnea. So prolonged apnea, this is mainly seen with the succinylcholine. When it is seen with the succinylcholine, so normally it does not happen. It happens only if the person is having any liver disease, if the person is born with a liver disease, or if the person is having any atypical pseudocholinesterase. If the person is born with the atypical pseudocholinesterase, then what will happen, the succinylcholine, it is not metabolized. It will stay for a longer time. Then what will happen, this leads to prolonged apnea. Now can we come to know whether the person is born with a typical pseudocholinesterase or atypical? Yes. It can be assessed by a, इसको हम असेस कर सकते हैं, हाउ, बाय डाइब्यूकेन नंबर, ठीक है. सो दिस इज अ लोकल एनेस्थेटिक. नाउ दिस एंजाइम, हाउ मच इट इज गोइंग टू, दिस typical or atypical pseudocholinesterase, how much it is going to hydrolyze succinylcholine, that we can assess by dibukane number. So a normal enzyme that is inhibited by dibukane 80%, whereas atypical that is inhibited by 20%. So a person with the dibukane number, अगर किसी में डाइब्यूकेन नंबर 80 है तो उसमें क्या है, नॉर्मल है. क्या है, पर्सन इज नॉर्मल. उसमें क्या है, टिपिकल कॉलिनेस्ट्रेज है, उसमें एटिपिकल नहीं है. बट इफ इट इज लेस देन 80, कोई भी वेरिएशन है उसमें, तो देन द पर्सन इज बोर्न विद द एटिपिकल pseudocholinesterase. Then the next adverse effect is flushing. Flushing is more with d-tubocurarine. So you all know why flushing is more. In the beginning only I told you the side effect of especially the non-depolarizing is because of skeletal muscle relaxation, and number 2 is histamine. So here flushing is more. Why flushing is more? The reason for the flushing is because d-tubocurarine, it causes a huge release of histamine. So that leads to flushing. It is less with atracurium and mevacurium. Then same, this histamine, it also causes the precipitation of the asthma. Then hypotension, cardiovascular collapse, especially in the patient with the hypovolemia. Then the next adverse effect is muscle soreness. This is also seen with the succinylcholine. So succinylcholine, it causes the fasciculation. So during the recovery time, because of the fasciculation, patient complained of muscle soreness. Now another adverse effect is hyperkalemia. This is also seen with the succinylcholine, especially if the patient is having nerve disorder and muscle disorders. In cases mein. So here what happened? There is a release of intracellular potassium. So that leads to hyperkalemia. So that's why it is contraindicated if the person is having paraplegia, hemiplegia, any nerve disorders, and if the person is having muscle disorder like muscular dystrophy, crush injury, rhabdomyolysis, myasthenia gravis, and burns. So in all these conditions, succinylcholine, that is contraindicated because it leads to hyperkalemia. Then another, this is also genetically controlled, masseter muscle rigidity. So if it is there, then it is very difficult to pass the endotracheal tube with the succinylcholine. So you have to see that also. Then another adverse effect is succinylcholine. It increases almost all the pressure. Like there is a rise in intraocular pressure. So this is because of the fasciculation of the extraocular muscle. उसकी वजह से होता है. So this drug, it is contraindicated in glaucoma. Then rise in intracranial pressure, contraindicated in head injury. Blood pressure, because of blood pressure कैसे हुआ? Because of the stimulation of the ganglion, sympathetic ganglion. Increased intragastric pressure. This may be because of the muscular GIT muscle fasciculation. This can lead to nausea and vomiting. Then another adverse effect is succinylcholine. It may trigger malignant hyperthermia, especially when we are going to use it with halothane. Now, what is a malignant hyperthermia? The word itself says hyperthermia is there is increase in temperature. But it is not at all related with the irregularity or something related with the thermostat. Okay. Here what happens, there is a release of calcium from the endoplasmic reticulum. Huge release of calcium from the endoplasmic reticulum, which is going to cause a muscle contraction. A lot of heat is produced that leads to hyperthermia. This is also genetically controlled. It is a autosomal dominant trait, that is, it is related with that. So what happens, there is some abnormality in the ryanodine receptor. So this receptor, where it is present, ये आपका बेटा सार्कोप्लाज्मिक रेटिकुलम है, it is ऐसा, यहाँ पे this is a ryanodine receptor 1. Now what happens here, there is a continuous release of calcium and that leads to muscle contraction. Now what we give here, the treatment of choice is dantrolene. This is a directly acting muscle relaxant. This is going to prevent this release of calcium from the sarcoplasmic reticulum. So that's all about the adverse effect. So today we have covered the therapeutic uses and the adverse effect. So in the last slide you can see the red color which I have shown here, that is the adverse effect mainly which is seen by the succinylcholine. Just hypoxia, respiratory paralysis, this is with the non-depolarizing. But prolonged apnea, that is with the succinylcholine. Flushing, आपका histamine. Depolarizing agent, they do not release much histamine. Asthma भी फिर नहीं होगा, ठीक है. Then hypotension. So इसमें क्या, prolonged apnea, muscle soreness, increased intragastric pressure. So सारे almost all the pressure there, increased intraocular pressure, increased there is blood pressure and increased intracranial pressure, masseter muscle rigidity, hyperkalemia and malignant hyperthermia. So that's all about the therapeutic uses and adverse effect of the peripheral acting neuromuscular blocking agent. Thank you.